Hi Drew, how are you today?
Okay, thanks. How are you?
Good, thank you. Thanks for asking. My name is Dr. Maverick. I'm one of the counsellors here, and I see that you've signed in early, so I could talk to your workplace supervisor. And she brought you in here today. And just to let you know, Drew, that everything we talk about here today is safe and confidential. And as a professional, I'm covered under the Privacy Act, and this is a safe place to talk and discuss personal matters. Also to inform you that you have the right to refuse this service and whether you would like to partake in this service. Okay, so after the interview, Drew, I will be going over the alcohol screening questionnaire tool. Is that okay with you?
Yep. So they think I am a drinking delinquent and taking time off work, and so does my family here. Yeah. I've been drinking since I was 16. My mother and father were drinkers, and my family think I've been drinking excessively. Yeah, so we really started this because this past weekend my family came to pick me up because it was a work party and I was drunk already, and when they came to get me, so I couldn't go, and now everybody's pretty pissed at me. I've been using other illicit drugs, so they asked you to come into the agency. I don't want them all to hate me or anything, so I agreed to come.
Drew, asking you to be honest with me as you can be, do you believe that you have a drinking problem?
I mean, I like to have a few drinks every day. I think it's okay, and yeah, I drink every day and I'm not hurting anybody.
Yeah, okay. Thank you for that. Do you mind if I ask you a few questions? I've noticed that your answer that there is plenty of drinking. So how often do you drink now? Pretty much every day?
Well, I think every day, especially on the days off, work or work parties. For sure, like during the week, I'll go to the best local happy hours, and no, I just have a few or so on. So I'll go after work to the local and have some drinks.
And how about on the weekends?
On the weekend, I kind of keep to myself, and become drunk a little whatever I have at the house, but I don't really go out a lot, and weekend mostly just stay at home, drink whatever is out there, and any other drugs.
Through, let's just say the weekend just gone, how much were you drinking? This is say on the weekend.
Oh, it's hard to keep track. I'd say a couple of 6 packs of heavies over maybe like 2 or 3 cases of beer, wine, spirits, and throughout the weekend, if there's something on sale, like the liquor store down the street, I'd like a bottle of good red or white wine, something to go along with it.
All right, and what about during the week?
Oh, I just stay at the bar for a few hours, maybe have like 6 or 7 drinks and then go home. And I'll have a glass of wine when I get home.
And are you drinking more than you want to?
Well, I guess so. I mean, I've kind of tried to make a determined effort with willpower to just weekends to drink some, and that hasn't really kept up because I like to go to the happy hours and stuff.
So you've tried to cut down before? Drew?
Oh yeah, I have. I really have tried. Just yesterday afternoon though, I don't really see it happening.
Do you have any cravings from alcohol?
Yeah, you could say, yeah, I'm at work, I want to drink with all the pressure at work, and it helps to numb the pain, and now doing stuff I don't like afterwards, I want to drink, but other drugs helps me get through those times.
Okay, are you drinking Are you using excessively alcohol, or are there other drugs involved right now in your life than just alcohol?
Well, it's legal alcohol. I was inpatient a couple of times. I was an inpatient
Yep.
a couple of times for cocaine abuse, but I've stopped that. It's not really something I want to do anymore.
So when was the last time you were an inpatient?
About 3 months ago. A facility 4 or 5 months ago.
Okay. And at that time you used cocaine?
Yeah, I was using cocaine, and I'm clean 2 months now.
Oh, good. And why did you stop using cocaine or some of the other drugs you're using?
Well, I graduated from college. I was kind of a party animal in college, and then I had to get a job. I had a child, and it's kind of, I had a fear of losing my job because of cocaine and other drugs. I had to get a drug test and stuff, so that's kind of it in the back of my mind with that. So yeah.
And I see you in your hospital notes that you were in for treatment for that cocaine abuse. Do you think that the treatment helped you in a lot of ways with the cravings?
Yep. I think the treatment helped.
So, do you have those drug cravings now, or just alcohol?
Nah, mostly just alcohol.
Okay. And how about your work? Are you having any trouble keeping your job, or your performance on your job is okay?
I think I'm not doing tip top of the job of what I could be doing, but yeah, it has really created a problem. But I have been threatened with warnings and suspensions to be fired like that. But you know, I'm coming up to long service leave in 3 months. It's a while, but 11 sneak. I'll sneak in and out for a sip or two at lunch, so no big issues.
All right. Any social problems because of the alcohol use with your family?
Oh, I have a distant relationship with my family,
Oh,
so kind of right now, yeah, not really. My friends, though, when I go out with them during the week with work colleagues, I'm fine, but they're just not used to having that much fun that I'm used to today. So some difference, yeah. Sometimes they want to do stuff and go to movies and whatever, and I just don't go because I want to go. I'd rather drink and become drunk.
Okay. So more of a social closeness with your friends when drinking, or your work parties?
Yeah, I'd say that I'd rather go to party somewhere, and so I guess that I've had some social problems with my family and my close friends, yeah.
So not so much with your friends a little bit, but more with your family, in a distance with your family members.
Yeah, I guess my friends aren't that happy with me, but about it, but I don't think it's a huge deal. My best friend and husband, Paul, we haven't talked in a couple of days because he's mad at me for not coming to dinner with him the other night because I would rather drink with friends. That's what I want to do.
So have you been? So you have been some problems with your alcohol abuse, and this is reflecting with those around you.
Yeah, I guess with some friends and family and work. Yeah, I guess so. Yeah.
Okay. Drew, have you found that you're engaging in any activities that are like physically dangerous because of the alcohol?
Oh, I've overheard a couple of times. I can't remember. I apparently fell down the steps, was punched or fell over a table. I mean, who hasn't had a couple too many? But it's not like I'm going like skydiving or driving drunk or anything like that, you know. So I did sprain my ankle a couple of months ago that fell on the local bar steps. But other than that, I've been okay.
Did you find that you have any exacerbated of symptoms that you've already had, like any other medical or mental health problems made worse by the alcohol?
Nah, I've been pretty healthy so far.
Yep.
Only a couple of trips to the ER so far, so not too bad.
Did you notice a point after you started drinking when you had to increase the amount that you drank to get the same effect?
Oh, yeah.
And when did this happen?
I think I kind of go through phases with it, you know. I'll drink a certain amount for a little while, then I'll notice, I'm not even drunk anymore, so I'll have a drink some more.
And when was the last time you noticed that you did notice that you had to drink a lot more to get that same effect?
Let's say like last weekend, you know, I was drinking a couple of beers in my house, and a few hours have passed, and then started drinking probably like 12 hours. 12 beers, sorry. And I wasn't feeling anything to start drinking and mixing my drinks a little faster, and then I started to feel a little better, laughing and dancing, you know.
So Drew, how about your withdrawal? Do you have any symptoms? Have you had any symptoms of the trouble when you've stopped drinking? Like, for example, any physical symptoms, anxiety, stress, feelings of maybe depression or feeling down the dumps?
Oh, yeah, at times my treatment at hospital rehab taught me some skills battling withdrawal symptoms. And it creeps in more, but I have a headache now. That's typical. When going cold turkey and stopping altogether, usually body soreness and muscle aches.
Oh, well, Drew, after going over this, are you open to seeing a counsellor here at the agency?
Yeah, I think that's what my family, my employer and friends really want, so it's okay. Maybe I'll try it out once or twice and see what happens. But I guess to make them happy, I'll try it. Can't hurt, eh?
Are you agreeing, Drew, because you think it's what's best for them or for yourself, Drew?
No, I do want to nip this addiction in the bud. It's affecting everyone, not just me.
Yeah. Well, I'll get you scheduled to see a drug and alcohol counsellor. And most importantly, Drew, I want to thank you for telling me what's going on and for answering my questions. It's been very helpful, and with time and patience, Drew, I'm sure we can help you with this problem and help you on the road to recovery with all of our staff and our resources, Drew.
Alright, yeah, sure.
Okay, so come with me to reception and we'll book you into available time.